Nasal decongestant sprays, which AFRIN is in that category, they work wonderfully. But what you need to know are the dangers. Now, this is a scenario that I have had so many times. A patient calls me and says, Dr. Jen, or they come to the office, they're like, I can't get rid of this nasal congestion. And I'm like, okay, well, tell me about it. Like, what's going on? And they talk about a story where they got some nasal congestion and then they started taking a nasal decongestant like AFRIN or something else over the counter. It worked like a charm, so they actually kept using it beyond the amount of days that the bottle said to use it. And what they tell me is that, yeah, it's weird, when I use it, it works, but if I don't use it, I get super congested. It's like it comes right back. And you know what? They're right. There's actually a name for this. It's called rhinitis medicamentosa. That is actually the overuse of nasal decongestant sprays. It's actually a problem. So let me explain what's going on here. Nasal decongestant sprays like AFRIN, honestly, they work like a charm, right? I'm not here to bash AFRIN. And by the way, AFRIN is not the only nasal decongestant spray on the market. It's just one that people know a lot. Many of the nasal decongestant sprays that we have on the market, if you look very closely at the back of the label, which you should be doing with any medication you're taking, says not to use more than a certain number of days. If you use nasal decongestants for more than the number of days that is recommended, actually it can cause what's called rebound nasal congestion as the medicine starts to wear off. That is what my patients experience as, well, hey, when I use it, it works great, but when I stop, the congestion comes right back. And what that prompts patients to do, yourself perhaps included, is then to go back and use it again to relieve the congestion. The problem with this is that it begins a cycle of vicious nasal congestion that's caused by, but also relieved by, the use of a nasal decongestant like AFRIN or so many others. And what happens is you keep going along this cycle. You use it because you have to, and when you don't use it, you need to. So then you use it, and then you have to, and all of this kind of continues. This cycle is called rhinitis medicamentosa. Okay, the problem with this is actually it can cause dependency on the medication to try to sort of clear up the congestion, but again, it's just a cycle. So I know you're probably saying, well, gosh, what am I supposed to do? I mean, AFRIN works really great for me. Once again, not here to bash AFRIN. In fact, it works quite nicely along with many of the other nasal decongestants on the market. First of all, what you need to be doing is checking with your doctor to see if a nasal decongestant is what you should be taking for whatever's going on with you. Many times we doctors recommend them for certain things. But the key here, the name of the game, is to use them appropriately. Do not use them longer than the box says to use them for. And also, not only do you not want to use them for more days than it says to, but you also don't want to spray, literally, you don't want to use it for more days, but you also don't want to use it within a day more times than it says on the box. Oftentimes, you need to use nasal decongestants less than 5 days, but many brands say actually to use them for 3 days or less than 3 days, something like that. Okay, read the label. All right. Things can get better. You can get better from the congestion, but I'm going to tell you this, what we do initially is we stop people from taking nasal decongestants if they've gotten this rhinitis medicamentosa. And let me tell you, your congestion is going to get worse very likely before it gets better. It's a little bit of like a withdrawal. Okay. Sometimes what we do to help, and by the way, like I said, you can get back to your baseline. Sometimes we will use intranasal steroids to help with sort of easing the inflammation and the swelling and the fogginess that you might have in the nasal passages. Sometimes people may require other medications, whether it's oral steroids or something like that. And honestly, according to some medical sources, it can sometimes take up to a year to get rid of this, to sort of get rid of the nasal congestion caused by the dependency of taking a nasal decongestant inappropriately. So this is why I'm doing this video. It's not to tell you that AFRIN and nasal decongestants, other ones, are bad. It's to tell you that they must be used appropriately and to understand the potential side effects and dangers of not using them appropriately and the problems it can cause. I would love to hear, has this happened to you? Has it happened to someone you know? I would say probably every year or two, I get a patient who talks to me about this. They use the medicine because it works so well, so they keep using it, and then they become dependent. Their nose becomes dependent on it, and then they have to use it. And if they don't use it, it gets congestion and stuff, and it's a problem. It's a cycle. So let me know in the comments if this is you, if this has happened to you, what your thoughts are, your experiences. I always say what you express to us often helps other people. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. Guys, please like and follow my page on Facebook. Please subscribe to my channel on YouTube. Click the little bell for updates. I'm on TikTok, WhatsApp, LinkedIn, Instagram, etc. at Dr. Jen Caudle. And please sign up for my daily, I always say this, please sign up for my free weekly health newsletter at drjencaudle.com. Guys, love y'all.